Hi, I'm Dr. John Young, Medical Director here at Foundational Health Center here in Largo, Florida. And one of the things, or there's several things in medicine that are really hard for me in dealing with patients. One is I never want to tell a patient they have cancer. That is just, you might say, a big game changer, because there's so much that goes on with cancer and life and death, and it's never fun to tell a person they have that. Another thing that really is right up there with that for me is telling someone that either they do or their family member has Alzheimer's or some type of dementia, because that becomes just almost like cancer. It's a complete lifestyle change. The family's affected, the individual, all the caregivers. It is very, very scary. And also, there's really not a whole lot that we really have out there in dealing with Alzheimer's and dementia. So Alzheimer's, dementia, we're going to put those two together, is something that I've been looking at for a number of years. And I'm seeing more and more patients coming in at a younger age with mental problems, forgetfulness, and not just you forgot the keys, but where it's really affecting their lifestyle. And so I would look at the American Journal of Medicine or the New England Journal of Medicine, and they're talking about drugs that we're going to test, and none of the drugs seem to be that great. So lately, because I've been dealing a lot with autistic children, I've been looking at a lot of the genetic things and the biochemical things that are going on in the brain of these patients, both autism and dementia and Alzheimer's, and realizing that there are some very interesting components that all of these diseases have. Number one is they all seem to have high levels of a protein called alpha-synuclein, alpha-synuclein. And this is a protein that all of us make, but for some reason, this protein gets folded in an odd manner, and it messes up this whole neural system in our body. If it's in certain areas of the brain, it's called MS. If it's in other areas of the brain, it's called Parkinson's. Other areas of the brain can be called dementia, Alzheimer's. But this protein, along with some other proteins called tau, TAU proteins, and amyloid, another type of protein, they all have a big, big say in these dementias. And what we've noticed that as the patient gets older and older, that the cells fill up with these proteins and they gum up the works. And they fill the mitochondria up with these proteins. And it just slows the whole working of the brain down. And there's really nothing out there that they know of that really works. Well, that may not be true, because when you're looking at medicine like we do, biochemically, genetically, getting down to the really what's happening in the ion channels and things like that, there's some very promising things going on. And one of the things that we're looking at is, and seeing some very great benefits in our patients, is there's a drug, i.e. supplement, called Qiapi, Qiapi. And what it does in this one study of 120 patients with Alzheimer's, all in nursing homes, and putting on Qiapi, which all it does is makes the mitochondria work faster to get rid of these synuclein implants, amyloid implants, tau protein implants within the cell. It just helps the cell get rid of these quicker, get them out into the sewage system. And after a 6-month study of the 120 Alzheimer's patients, 80 of them were discharged from the nursing home because they had no more Alzheimer's. That's a pretty good percentage. Now, in these dementia problems, there's a big problem with that whole electrical field. And what they found also is that if you can make the electrical stimulus in these brain cells stronger, the dementia seems to get much, much better. So there's some interesting work we're doing with 4-aminopyridine, which is an old drug. It's hard to find anywhere nowadays. But it dissolves the tau protein complexes and the amyloid complexes and the synuclein complexes in these brain cells. So you're actually trying to get the person better. You're not just trying to throw a drug at it and trying to slow the process, but you're actually trying to get them better. And then there's some other interesting things that we're looking at that seem to work quite well, which is the use of umbilical cord stem cells, Wharton's jelly, and exosomes, because all of these things work in getting rid of those proteins that gum up the central nervous system with dementia and Alzheimer's, which is the tau proteins, the amyloid proteins, and the alpha-synuclein proteins. And I will keep you informed as how our patients are doing, but so far they're doing extremely well. Exactly what these articles are saying is if you clean up these proteins, you can reverse, looks like, a lot of these diseases. So I hope this is encouraging to you that dementia, Alzheimer's, there is some very good news out there, and you may want to check into it with your doctor.